Welcome to the deep dive. Today, we're tackling a really specific and a potentially devastating injury in the animal world, brachial plexus avulsion.
That's right. We've got a detailed medical text here as our source, and we're going to, really dig into this type of nerve damage that affects an animal's front leg.
Okay, so our mission today is to pull out the essential info. What exactly is this injury? How does it happen? It sounds like it's often quite dramatic.
Definitely involves significant trauma.
And what are the kind of telltale signs you might notice in your pet? And crucially, what are the possible outcomes?
Right. We want to arm you with some key knowledge. It could be really invaluable if, heaven forbid, your pet ever has a severe injury to a front leg.
Okay, let's dive right in then. Fundamentally, what's the issue with a brachial plexus avulsion? What's actually happening?
Well, at its core, it's about the tearing, the actual ripping of tiny nerve rootlets right where they come off the spinal cord.
Oof. And this isn't just from a little bump, right? The text says it's from serious trauma.
Yeah.
Exactly. Significant trauma. Usually it involves a really forceful pulling, they call it traction or severe abduction.
Abduction, like
Yeah.
the leg being yanked really hard away from the body.
Precisely. You can imagine the kind of force needed for that. And an important point from the text, the motor nerve roots, the ones controlling movement,
Yeah.
they seem to be more easily damaged, more susceptible to this tearing than the sensory ones that deal with feeling, like pain.
Okay, that's a critical difference. So if an animal's been in an accident, maybe hit by a car, and suddenly can't put weight on a front leg, this kind of nerve damage has to be high on the vet's list.
Absolutely. Our source stresses ruling this out, especially before, say, rushing into surgery for a broken bone they might also have.
Because the management would be totally different.
Totally different. The prognosis, the treatment options, they hinge on knowing if these nerve roots are torn or just maybe bruised. Getting that diagnosis right early on is key.
Makes sense. So who gets this? Is it specific dogs or cats or certain breeds? Actually, no. The text is clear.
Mm-hmm.
It happens in both dogs and cats.
Yeah.
And there's no specific age, sex, or breed disposition mentioned.
So it really just comes down to the trauma itself.
It really does.
Hmm.
Any dog or cat could potentially suffer this if they experience that kind of forceful event.
Okay. So what are the signs? What are the red flags someone might see if this has happened?
Well, it really varies quite a bit. It depends on how many of those little nerve rootlets are torn
Yeah.
and, exactly which ones along the spinal cord are affected.
Right.
But broadly speaking, on the movement side,
Yeah.
you might see anything from just some weakness in the leg.
Suggesting maybe partial damage?
Exactly. Partial damage. Or it could be complete paralysis of the limb if those ventral roots, the main motor ones, are completely avulsed, completely torn away.
And what about feeling? Sensation?
Yeah, if the dorsal roots, the sensory ones are involved, you might see decreased pain sensation or even completely absent pain perception in that leg.
Which is obviously a very serious indicator.
Very serious. And another thing the text highlights is muscle atrophy. The muscles start to waste away,
How quickly?
surprisingly fast, often within just a week of the injury happening.
Wow, okay. A week. That's rapid. So the source breaks this down further, doesn't it? Based on which specific nerves are hit. Let's start with a complete avulsion.
Right, a complete avulsion. That means basically all the nerves contributing to the brachial plexus from the C5 spinal segment down to T2. They're all damaged.
And that's the most common type.
It is, unfortunately. And the result is typically a complete loss of function in that whole front leg. It's just limp.
Okay. Then there's cranial avulsion affecting C5 to C7. What does that look like?
With a cranial one, you see specific signs: atrophy, that muscle wasting, in the key shoulder muscles, supraspinatus, infraspinatus.
So the shoulder area looks different.
Yeah, you lose that normal shoulder contour. And you get loss of shoulder movement, a kind of characteristic dropped elbow where it just hangs flexed. Plus, loss of feeling, usually over the top of the shoulder blade and the inside of the forearm. But here's the interesting bit.
Yeah.
If the nerves further down, C8 to T2, are spared,
Yeah.
the animal might still be able to bear weight almost normally.
Really? Even with those shoulder issues?
Yeah, it's quite specific. The text also mentions a possible complication: hemiplegia, the diaphragm on that side, paralysis of half the diaphragm. You'd need special imaging like fluoroscopy to see that, though.
Huh. That really highlights how localized the deficits can be, depend exactly which wires are cut, so to speak.
Precisely. Now contrast that with a caudal avulsion. That affects C7 down to T2.
Okay, what are the signs there?
The key thing here is usually an inability to bear weight, and often you see knuckling over of the paw.
Where the top of the paw drags?
Exactly. They can't position the paw correctly.
Hmm.
But if the nerves higher up, C5 to C7, are okay, the leg is often held bent, kind of flexed up, and sensation is lost below the elbow, except
Hmm.
for maybe a small patch on the inner forearm.
Got it. And the text mentioned T1 and T2 involvement specifically.
Yes, if those T1, T2 roots are damaged, it can cause what's called ipsilateral partial Horner syndrome.
Ipsilateral meaning same side.
Same side, yeah. And the text specifies it's often just anisocoria, so unequal pupil sizes, one pupil bigger than the other on the injured side.
Okay.
You might also lose the cutaneous trunci reflex on that same side, that little skin twitch along the back. It would still be present on the other, unaffected side.
Right, I know that reflex. And finally, bilateral avulsion, affecting both sides. That sounds awful.
It is. Thankfully, it's rare. It usually happens after really major trauma, like a significant fall where the animal lands hard on its chest, its sternum, and both front legs are forced out violently.
Okay, so clearly a wide range of signs depending on the exact location of the damage within that nerve complex.
Yeah.
What actually causes this? What kind of accidents?
The text lists the usual suspects for severe trauma. Road accidents are common.
Right.
Also, situations where an animal gets a foot caught and is, well, essentially hung by it. Horrible to think about,
Yeah.
being dragged. Sometimes seen in abuse or neglect cases, unfortunately, and significant falls from a height.
Basically anything that causes that sudden forceful pull or yanking away of the front leg.
Exactly. Any event with that mechanism has the potential to tear those delicate nerve rootlets.
Man, it really drives home how important it is to keep our pets safe from those kinds of situations. Okay, so a vet suspects this. How do they confirm it? What's the diagnostic process? And what else could it be?
Diagnosis often starts with a history. Was there a known trauma? And the sudden onset of those neurological signs we talked about.
The limb weakness or paralysis, the sensory loss.
Right. Then a very careful neurological exam, mapping out exactly what the animal can and can't move, where it can and can't feel pain. That assessment of motor and sensory deficits is absolutely crucial.
Checking for Horners, too. And that skin twitch reflex.
Definitely. Those help pinpoint which nerve roots might be involved. They give clues about the location and severity.
Are there more specialized tests?
Yes, electrodiagnostics can be very helpful. Things like EMG, electromyography, and nerve conduction studies, NCS.
What do they show?
Well, they can detect electrical signs of denervation, basically, evidence that the muscles aren't getting nerve signals anymore. This usually becomes apparent about 5 to 7 days after the injury.
Okay.
These tests help define the extent of the damage, and importantly, they can sometimes pick up early signs if any nerve recovery is starting to happen later on.
What about imaging, like X-rays or MRI?
X-rays are important to rule out fractures, of course. The text mentions that advanced imaging like CT or MRI can visualize the lesion, the damaged area near the spine, but often they aren't strictly necessary for the diagnosis itself. The clinical picture, the neuro exam, and maybe the electrodiagnostics are usually enough.
Right, and you need to be sure it is avulsion, not something else that looks similar. What are the main differential diagnoses?
Good point. There are several things to consider. One is brachial plexus trauma without the rootlets actually being torn off, maybe just severe bruising or temporary compression. That's called neuropraxia.
And the signs would likely improve with that.
Yes.
Huh.
Typically, those tend to resolve over time, unlike a true avulsion. Then there are brachial plexus tumors,
Yeah.
but they usually cause signs that come on much more slowly, progressively.
Okay.
There's also brachial plexus neuritis, or neuropathy inflammation, or disease of the nerves that can cause sudden signs. But usually there's no history of trauma, and it often affects both front legs.
What else?
Fibrocartilaginous embolic myelopathy, FCE, that usually affects the hind limbs more, but sometimes you can see mild front limb signs. A pure radial nerve paralysis.
Just one nerve.
Yeah, often linked to a fracture of the humerus, the upper arm bone, or maybe the first rib.
Right.
But you wouldn't typically see the nerve root signs like Horner's or the loss of the skin twitch with just a radial nerve problem.
Right.
And finally, maybe a slipped disc in the neck, a lateralized intervertebral disc protrusion. That can cause limb weakness, but usually the animal is also quite painful, which might be less obvious with a severe avulsion where sensation is lost.
Got it. So the history and a really detailed neuro exam are key to sorting these out.
Absolutely. And the text also notes that routine blood work and urine tests are usually normal in brachial plexus avulsion cases. Doesn't help much with the diagnosis itself.
Okay. Let's look closer at the damage itself. What's actually happening at the site of injury? What are the pathologic findings?
The source explains that these tears, the avulsions, happen intradurally, meaning within the dura mater, that tough outer covering of the spinal cord.
Right near the cord itself.
Exactly, right at the junction where the nerve rootlet emerges from the cord. And this area is apparently quite fragile because it lacks a protective layer, the perineurium, that covers the nerve further out.
Ah, so it's structurally a weak point.
Seems so. The text also mentions you can sometimes find an neuroma, which is like a disorganized mass of nerve tissue, kind of like scar tissue forming on the surface of the spinal cord where the rootlets tore away.
So a really significant injury at a critical spot. No wonder the effects can be so severe. Okay, the big question then. What can be done? What are the treatment options?
Yeah, this is the tough part. The text is quite clear. There's no specific treatment to repair the torn nerve roots themselves. You can't just sew them back on.
Right.
So the outcome really depends heavily on how bad the initial damage was, how many roots were torn, and how completely.
So what can be done? Is amputation often necessary?
Amputation is definitely a consideration, unfortunately, especially if there are complications like chronic infections from dragging the paw, or if the animal starts self-mutilating the limb.
Because of abnormal sensations, maybe?
Exactly, paresthesia. If those issues arise, and if there's been no sign of functional improvement after a period of monitoring, then amputation might be the most humane option for quality of life.
That's a really difficult decision for owners. Are there any surgical options short of amputation?
The text mentions a couple of procedures, but with big caveats, things like carpal fusion, fusing the wrist joint to make it stable for passive weight bearing, or a biceps tendon transposition to try and restore some elbow function. But these are only potential options if there's still good function in certain key muscles, specifically the triceps muscle, which extends the elbow, and the muscles supplied by the musculocutaneous nerve. So the nerve damage can't be too extensive. They're not common procedures for this.
So surgery isn't a magic bullet here. What about supportive care? That sounds crucial.
Absolutely vital. Good nursing care is paramount. This means things like protective wraps or boots for the paw if it's being dragged or knuckled over.
To prevent injury because they might not feel it.
Precisely. Reduced sensation means they can get sores or infections very easily. And then there's physical therapy. Early and consistent PT is really important.
What does that involve?
Things like passive range of motion exercises, gently moving all the joints of the leg through their normal range of massage. This helps to prevent severe muscle wasting and stops the tendons and joints from getting stiff and contracted.
Especially important if there's any chance of nerve recovery later on.
Exactly. You want to keep the limb in the best possible shape, just in case. The text advises monitoring uncomplicated cases for a decent period, maybe 4 to 6 months.
Before considering amputation.
Right. To give any potential nerve healing a chance, however slim it might be.
What about medications? Any role for drugs?
The text does mention that a short course of an anti-inflammatory steroid, like prednisolone or prednisone, might sometimes be used right after the injury.
Why?
The thinking is it might help reduce some of the initial swelling around the injured nerve roots and perhaps support the healing of any damage that's potentially reversible, like that neuropraxia, the bruising or stunning of the nerves. It's not a cure for the avulsion itself, though.
Okay, so it sounds like management is really about support, protection, physical therapy, and patience, waiting to see what happens. What about follow-up?
And potential complications down the road.
Regular follow-up exams are definitely needed. Serial clinical assessments, checking neurological function again and again.
And maybe repeating those electrical tests. Yes, repeating the EMG and NCS can give objective evidence of whether things are staying the same, getting worse, or maybe, hopefully, showing some signs of reinnervation, of nerve recovery.
And prevention of further injury.
Crucial. The text advises avoiding letting these animals roam free. Keeping them safe, supervised, or confined to prevent any further trauma is really important.
And complications, we touched on some.
Yeah, the big ones are skin damage and secondary infections on the paw or leg from dragging or lack of sensation. Trophic ulcers, basically skin breakdown due to poor nerve supply and circulation, can occur, especially sometimes after surgeries like carpal fusion.
And the self-mutilation?
Right. That paresthesia, the abnormal tingling or burning sensation, can be distressing enough for some animals that they chew or lick the limb excessively, causing severe damage. That's a very difficult complication to manage.
Absolutely heartbreaking. Okay, let's talk prognosis. What's the long-term outlook typically like?
It really varies hugely, as you might expect now. It depends entirely on the severity and location of the nerve root damage.
Are there any positive prognostic signs?
Well, the text suggests that if the animal still has deep pain sensation in the paw, that might indicate the damage to the motor roots isn't quite as severe, potentially offering a slightly better chance for some functional recovery.
Yep.
Not necessarily full function, but maybe some.
Okay.
Also, in those cranial avulsions, C5, C7, if sensation in the lower leg and paw is preserved and they can still bear some weight, the prognosis might be considered a bit better than for a complete avulsion.
But for the complete C5T2 avulsion.
For a complete avulsion, the prognosis for regaining useful limb function is generally considered poor to grave. Amputation is often the eventual outcome in those cases for the animal's comfort and mobility.
That's pretty sobering.
It is. But the text does add a small note of hope. In rare, very mild cases, perhaps where the damage was mostly neuropraxia rather than full tearing, some resolution of signs might be seen within maybe 2 to 3 months. But that seems to be the exception rather than the rule.
So, a really wide spectrum of possibilities. It just underscores how complex and serious these injuries are.
Absolutely. And it really highlights why that initial thorough veterinary assessment is so critical and why owners need, realistic expectations set for the beginning.
Well, this has certainly been a very thorough deep dive into brachial plexus avulsion. I think the key takeaway for everyone listening is that this is a really serious nerve injury, usually caused by significant trauma. The signs and the outcomes can vary a lot depending on exactly which nerves are torn and how badly.
And it just reinforces how vital it is to get immediate veterinary attention if your pet has any kind of accident, and then shows signs of forelimb dysfunction, weakness, paralysis, dragging the paw. Early diagnosis and the right supportive care are just crucial.
Definitely. On that note, here's a final thought for you to ponder. Given how delicate these nerve connections are right there at the spinal cord, it makes you wonder, doesn't it? What other, maybe seemingly smaller incidents or chronic strains in our pets' lives could potentially lead to more subtle neurological issues that maybe we don't even notice?
That's a really interesting point. It certainly makes you think about the hidden vulnerabilities and the connection between physical impacts and neurological health in our animal companions.
Food for thought. Thanks for joining us for this important deep dive.